All right, welcome everybody. It is great to have you here, and I am going to get this party started. Welcome, everybody. It is so good to have you here. Thank you so much for joining us. And I am going to open it up. I just need your help here. Just tell me that you can hear me, that you can see me, that I'll put up slides in a minute. We'll get that going. So go ahead and put that in the chat. Tell me who you are, where you're from, what kind of healthcare professional you are, and we will get this going. Thank you for being here. There are hundreds of you on here. Let me just get everything started here. So tell me who you are, where you're from, what kind of healthcare professional you are. So we've got Lisa from Seattle, who's a dental hygienist. We've got they're going too fast. Milagros, who's an NP from Orlando. We got Jamie, nurse practitioner from somewhere. It went away before I could get to it. We have, wow, they're coming way too fast. Carol from Chicago and RN. Okay, I got that one. Derek, a dentist from Utah. Okay, we have got Peter, who is an MD from the great state of Texas. Vibhuti, I think I said that right, a dentist from Seattle. Carrie is an Oregon nurse practitioner. Thank you. Just so you know, this is real and you can see him as I see him. Thank you so much for being on here. We're going to jump right in and let me just make a few. You can keep putting your names in there. I'm sorry, I'm not going to get to everybody just for the sake of time. But thank you for being here. We're going to show you the best Botox techniques for 20-year-old patients. I better get my slides up here and let's see. How do we do this? Give me a second, and I've got to check one thing first. Here we go. And we will then get started. Feel free to answer questions at any time, if you would be so kind. All right, let me get rid of that. And now we can go ahead and share this. Tell me that you can go ahead and see my slides. That would be very helpful too. And then we will really get going here. So tell me you can see my slides. Should be able to see me. Should be able to hear me. We are good to go. Thank you so much to all of you for joining us. This is a great topic, quick topic that we're going to cover. We're going to show you 3 different Gen Zers or 20-year-olds who are going to be going and getting Botox. Some for a couple for the first time and some for multiple times. So you go ahead and take a look. And we're going to go from simple cases to more involved cases here. So the quick introduction is, my name is Dr. Louis Malzmacher. I'm president of the American Academy of Facial Aesthetics, the AAFE. Welcome if you have been with us before, and welcome if you're brand new to us. Doesn't matter if you've ever injected Botox before or you're an advanced injector. This is going to be for absolutely everybody and all healthcare professionals. If you're not a healthcare professional that can inject, this is not the right place for you. There's my email. There is the American Academy of Facial Aesthetics email. Here's a whole bunch of websites, some of which we're going to point to through this webinar if you want to take a quick photo of this, because this will be a really, really good resource for you. We're going to jump right into our topic here. So feel free to ask questions at any time. We may stop at certain points and take some questions from you, but feel free. I am happy to stay afterwards for as long as you would like and go ahead and answer any questions about injectables. So I'll offer that to you there as well. Please follow the AAFE at Facial Aesthetics on all the different social media channels. You know them all. And this is what the AAFE is about, just in a couple of slides, literally, and then we are going to really get going here. The most trusted name for injectable training when it comes to Botox fillers, PDO threads, lifting, or smooth. We've trained over 20,000 healthcare professionals. We regularly consult with all the medical, dental, and nursing licensing boards to make sure that you are safe and you are documenting well and you are practicing within your scope of practice. We talk about new injectables and technique development. We do a lot of research. We have our own cadaver labs and products research there as well. We've got full-time faculty to help attendees, and we have got the best faculty in the world. These are part-time, these are full-time. This is a combination of physicians, dentists, nurses, nurse practitioners, PAs, dental hygienists, all who have very successful practices. I cannot tell you how much I love each and every one of these people because they are fantastic people, fantastic teachers, but they're real world. They live in in their offices just like you do. They deal with patients. They inject just like you do, or the way you want to, and they run very, very successful practices. So we are so proud to call them our faculty. They are all really, really fantastic people for that. This is just philosophy in the AAFE. The patient's not buying Botox. The patient is buying you. We are not going to make you the best Botox injector because they can go anywhere to be a Botox injector. We're going to make you the best injector because you are what they are looking for. If you're just going to be another Botox injector, then they've got lots to choose from. There is absolutely no reason that you're differentiated from anybody else. But if you become the best injector, and that's exactly what AAFE Live Patient Training does, then they will flock to you. You will never have to worry about patients for that. Now, I just wanted to say this. I'm not going to talk about training. I'm not going to talk about any tuition specials until the end for those of you that are interested in that. But the AAFE is going to make a great tuition offer. But if you stay till the end, you will discover the #1 training that injectors use to make $50,000 to $100,000 a month, many times in additional to existing practices you may have already. While your family and existing patients are already paying someone else for Botox, they should be paying you. This is the best investment that will pay you back with your first 5 to 6 patients. And then you have this for the rest of your career, and how to implement Botox and fillers in under 30 days. And then a very special bonus for those of you who stay to the end. But before we begin, I just want to tell you, and I'm showing patient before and afters. There's a reason I show you patient before and afters, to show you these are the patients that you can do and that we can accomplish together, and with training and with a real curriculum. It's about proven growth. And if you are open to learning new ways of building your dream career and your dream practice, then definitely stick around. This is something that we've proven 25,000 times over many, many times with all different kinds of healthcare professionals. And if you stay to the end, we'll get to how you can really get to that full transformation. But I do want to find out one more thing about all of you. And I really want this to be, no matter what platform, because we're on multiple platforms right now, for that. The webinar platform probably being the easiest for most of you, but certainly we're on multiple platforms right now. I just want to kind of take this survey for this. You have a dream. You have a dream of what you want your medical, dental, nursing career, nursing practice to look like. What's your dream? Go ahead and put the number of the dream, whether it's #1, becoming a med spa aesthetic practice owner, whether it's #2, achieve financial freedom. Put it in the chat. Put it in whatever chat and whatever platform you're at, maybe multiple of these. Everyone wants to achieve financial freedom. Who wants gain more free time? I mean, that's going to be a lot of you. Go ahead. I want to see it in the chat. I want you to really be involved in this, because then I know that you are going to get the most out of this. You want autonomy and choices in healthcare. That can be pretty difficult sometimes. You want to work in a med spa and aesthetic practice. You want to become a trainer. You want to serve as an example to a loved one, a son, a daughter, a father, a mother, a sister, or a brother. So let's see what we got going on here. So we've got all of the above, which is not that unusual. All 1, 2, and 3, Corinthia 1, 2, 3, 4, and that is that's what Daria says there as well. 1, 2, 6, 7, become a trainer, serve an example as others, achieve financial freedom. Certainly #2 is going to be very, very popular for this. Stephanie has got everything but #2, as I just went ahead and said that. For that. Let's see, Jennifer 1 and 2. A lot of people want to be a med spa owner. Some just want to work in a med spa. 2, 3, and 6. Achieve financial freedom, gain more free time. You get the idea of what people want. And certainly you can go ahead and see all of this yourself. I mean, that is exactly what everybody wants. Grow my business. Absolutely. That's exactly what all of us want to do. It gives you, if you're a nurse, this is really one of the only places in medicine where you get to actually have your own practice. Now, you've got to have medical directors. You've got to do everything by the book, right? If you're a dentist, you want to achieve more financial freedom, or a physician, or a nurse PA, or a nurse practitioner, or a PA, or any of those healthcare professionals, right? You want more free time. You want control of your time, right? Many of you want a 9 to 5 job for that. But certainly it's all of these things together. That's what I think a lot of us all want. And that's what you can really get in facial aesthetics. And you'll see how just, we're going to talk about clinical, but we're going to talk about these as well. And how this really is the best investment that you'll ever make in yourself because it pays off the fastest, literally more than any other investment you've ever made on yourself. It's really a dream practice with injectables. And this is, I mean, all I can say is so different than any part of medicine or dentistry or nursing for this. It's a recurring revenue center because Botox lasts for about 3 to 4 months, fillers last 6 to 12 months. It's by far the happiest part of your practice. It's really a dream practice because these are happy, healthy patients who are paying out of their pocket. You don't have to deal with insurance nonsense, and there's no capital investment. You're investing in yourself and your skills, no lease payment, the highest ROI of any other treatment that's out there. And I think the two bold ones are where we're going here. You finally get paid what you are really worth. And ask your family and friends if you should offer Botox and fillers. They will literally push you out the door. Gen Z and millennials, and that's why we're talking about Botox for 20-year-olds, which is unbelievable to me. Because when I first started, Botox, you were young if you were getting it at 35 years old. And now, as you're going to see, 20-year-olds are getting it. We're going to jump on the clinical really quickly here. They're making up now 35 to 40% of injectable patients in your aesthetic practices or med spas or dental practices, wherever you're doing aesthetics. AAFE members are up 30 to 48% in 2025. This whole baloney about injectables are down. Oh my God, nobody's doing fillers anymore, et cetera, et cetera. That is nonsense. That is really nonsense. Now, when it comes to AAFE members, maybe other places where you're getting trained, but not with AAFE members, and you've been thinking about doing this for a long time. For all of you who don't do this yet, do it. If you would have started 2, 3 years ago, you would be so farther ahead. 5 years ago, 20 years ago, when I started for that. So let's now go to why are Gen Z doing injectables. And I'm going to show you a TikTok clip that shows Gen Zers why they should get Botox, what Botox is, how long it takes to go into effect. It teaches everything they need to know in 30 seconds. Go ahead and watch this. Here we go.
I got my job, but not.
With it, trap with it, lean with it, pop with it, snap with it. All my ladies, pop your backs with it, with it, trap with it, lean with it, pop with it, snap with it. All my ladies, pop your backs with it, with it, trap with it, lean with it, pop with it, snap with it. All my ladies, pop your backs with it, with it, trap with it, lean with it, pop with it, snap with it. All my ladies, pop your
I
backs
love
with
it.
it.
Okay, she has got, you can look her up. I don't remember if it's 1 million or 5 million followers for that. She's obviously a Gen Zer. She told them pretty much, or anybody watching this, everything you need to know about Botox. First of all, I'm getting micro Botox. I don't need much because I'm young. Yeah, I'm getting it injected. Look what happens day after day after day. Kicks in, full effect somewhere around 10 days. She loves it. What else do you need to know? Really, what else do you need to know? And patients like these Gen Zers are coming in. First of all, they're heavily influenced by this. They're coming in. No, they don't need to know much more. Give it to me. How much is it? And let me go ahead and pay for it. And if they're starting when they're 20, they're going to be getting it for a long, long time because to Gen Zers, getting Botox and fillers is self-care like hair and nails, and they are paying for it. So these are very long-term patients for that. But now let's go more clinical on this. It's you, the injector. The neurotoxin, not that it doesn't matter, but there are a lot of good neurotoxins on the market. There's actually one more that's not listed here for that. All of these are fine neurotoxins. Which ones do we like the best? Botox by far is the king, most well recognized. For that, for us, Xeomin is a very close second. Why? The dosaging Whatever I dosage a patient with Botox, it's exactly the same with Xeomin. Xeomin is a little bit more of a pure molecule that matters to some patients. Xeomin is less expensive. So that is a big deal. And why are Botox and Xeomin so popular? By the way, we use these all in our AAFE med spas and training centers, and we teach about all of them. But why are Botox and Xeomin really the most popular ones out there? They have the broadest range of success. And the way if you're brand new to this, the way we dosage these things is called a unit. Whether it's 5, 10, 15, 20 units in each part of the face for that. So 1 unit of Botox is 1 unit of Xeomin. It's 3 units of Dysport, which makes Dysport a little bit different. These are all different molecules. Jeuveau and Daxxify are fine neurotoxins. All these neurotoxins will work pretty much the same way, but some of them can be a little trickier, a little bit more temperamental. It's hard to get a broad range of success. You've got to finesse the Jeuveaus and the Daxxify and the Dysports a little more. Doesn't mean I don't love them. I love them all, okay? They're just like children. Some are a little bit more finessable. You need to finesse them a little bit. I don't want to say more difficult, but you got to finesse them a little bit. Others are so easygoing, so much easier to get a great result, and that's really Botox and Xeomin. Xeomin has that extra plus of it's less expensive, and that certainly is a big plus as well. But it all comes down to 3 things: anatomy, safety, and technique. And I'll throw in one more thing, and it's gonna be precision. We're going to show you 3 different Gen Z Botox patients, going from easy to medium to a more involved case. And you're going to see how many units you can really give a Gen Zer, which can be quite substantial for all of this, depending on what their needs are. And that's really where we're going to go with all this. The science of neurotoxin. The science of neurotoxin is very simple. Let me just describe it to you in a minute, okay? How does Botox work? I'm going to call all the neurotoxins Botox just to make it simpler. But how does Botox work? You inject Botox into a muscle. And this is exactly how we describe it to patients there as well. So I don't care if you're new or you're an advanced injector, keep it really simple. We're injecting this neurotoxin into a muscle. And this neurotoxin is going to find the neuromuscular junction here, the way the nerves go ahead and squeeze that, cause that muscle to contract and cause that muscle to squeeze. What happens when facial muscles contract? Well, look at my frontalis. I'll get closer on the webinar platform so you can see it. Raises my eyebrows, this frontalis muscle right here, and I've done it long enough. And certainly once you hit 20, you can start to see fine lines. Certainly when you're 30, you can see some definite lines, and then they get more etched in. They get deeper the older you get if you are untreated with this. Finds the muscular junction, and it binds to it. The neurotoxin molecule binds to it, and it slowly stops the release of acetylcholine. Acetylcholine, Biochem 101, is what releases from the neuron to the muscle, causes it to contract. What will happen in a frontalis muscle or a forehead if I inject neurotoxin or Botox into that forehead? That muscle will start to go to sleep if I've injected enough, and then skin's natural state is smooth. That's how the whole thing works. Now, it's not just for smoothness, it's also great for oral facial pain, headaches, migraine, TMJ. Again, that's not our main topic tonight, but there are so many patients, Gen Z patients, that suffer from headaches, migraines, TMJ. You can make them look great and feel great with the same injection going into the same muscle. And that's really the beauty of what we learn in that, or what we teach in AAFE training, is that balance between the two. And patients love it. If you can make a patient look great and feel great, and Gen Zers, the proportion, 58% of Gen Zers now suffer from headaches and migraines. That is amazing. That's amazing. That it's sad, but it's an amazing number. I mean, what kids ever, I call them kids. I shouldn't call them kids, but at my age, I guess we can do that. But I mean, who had headaches? Who even thought about having headaches when we were 20 years old? The world's much more complicated these days, unfortunately. And we've certainly seen this, especially since 2020 and all of that. But this all boils down to one thing. You want to be a great neurotoxin injector, or a great Botox injector, you need to know the anatomy. cold. You need to know the muscles, how they work. Are they elevators or are they depressors? Okay, are they muscles of mastication, these big masseter chewing muscles, or are they facial expression muscles? That's a big deal to know how muscles work. And again, we're going to show you more about technique and more about what it can do, but anatomy is everything. We could spend 2 hours just on this anatomical slide and showing you cadaver sections, but we're not going to. That's a different program for that. But let's show you what it can do and how you inject it and those kind of things. The AAFE, by the way, has the best cadaver anatomy program that is out there. It's called Inject and Dissect. Here are the 2 upcoming dates, so you can go ahead and see that. Go to aafeanatomy.com to register. And they've got a discount going on right now. This is actually 2 courses in one because it also involves ultrasound training. So if you've taken a level 1 kind of equivalent course already, then this is probably for you. You can go ahead and take a look. Now let's talk about the 3 things that are super important, especially when you are treating Gen Zers, and then we're going to get to our first case. That is, number 1, they've got very tight skin and very tight muscles. They're young. So you don't have the ligaments have stretched out and you don't have the flabby skin so much. Some people do have that naturally, but most of them, tight skin, tight muscles, usually means a little lesser dose of neurotoxin for patients just starting out because everything is in really, really good shape. And these are such ideal patients for this. You need to adjust the dose. Are you treating actual lines, wrinkles, or are this for prevention? Well, in most actual 20-year-olds, it's probably they may have very, very fine lines, but that would be for prevention. So you've got to dosage appropriately for that. It's always going to be a little less when it comes to prevention here, and precision, precision, precision. And you see a lot of sloppy Botox being given, whether it's on social media for that. That's how you get complications like a droopy eye, a droopy eyebrow, a droopy lip. There are a lot of things that can go wrong, but not if you have exquisite technique, are really precise, and really know your dosage for that. But it's much different. Nobody wants to be a no Botox Barbie when they get older. I mean, with influencers like this that have millions of followers, I showed you one of 1,000 clips that I could show you of, oh, I'm going to get Botox today. Come with me as I go get Botox, et cetera, et cetera. You can go ahead and Google it or TikTok it or Instagram it, do whatever you want, and you'll see these all over. All right, let's show you a 20-year-old getting neurotoxins. So here we go. I'm going to turn off my video camera so you have a better experience. Here we go. Patient is 20 years old and getting some botulinum toxins. So what are the considerations? Well, you've got to make sure it's a great experience for this patient. Let's start with the frontalis and the glabellar area. That's all we are doing right now. Comfort Doc syringes for the best comfort because you want them to come back forever. But it's about precision and making sure that you understand on a patient like this that they have very tight skin and very tight muscles here. And that means that you have to be precise. You're not going to get a lot of volume and diffusion here. So you have to know exactly where you want to go ahead and put it, as you saw in the frontalis. And you must adjust the dose. And that's important. They don't need as much as an older patient because they have not made those dynamic wrinkle lines in the skin. That's the Proceres injection. Now let's go with the corrugator injections. This whole thing is not even 2 minutes. It's less than that. Here are the corrugator injections. Make sure you are placing it exactly where you want it. Hold that properly as you see being done so that you don't get any movement of the botulinum toxin down into the eyelids, and make sure we are not using a full dose as we would with an older patient. She doesn't need it because we just are doing prevention now to prevent those wrinkles from going ahead and getting deeper over time here. So we just want to weaken the muscles. You may not have to knock them out. Now, cleaning this is so important, up and away from the eyes constantly. You want to make sure you go up and away from the eyes. So make sure you don't move it all around a lot and give them proper post-op instructions. And here you see before and after. Now, you don't see much when it comes to a prevention case like this, but you don't want to drop the eyebrows. You don't want to drop the eyelids. You want to make sure that the patient has got a little bit of movement because, again, we are talking about prevention. So she doesn't need a full dose because she doesn't have the muscle intensity that an older patient is going to have. And that is demonstrated by not having the wrinkles that she has so far. So that's what prevention is all about with a 20-year-old. So make sure you know those considerations. And it's time for you to learn how to do this and time for you to get AAFE certification trained today. So let's take just a little bit more. By the way, she's not going to get only neurotoxin. Of course not. She's going to get lips. What 20-year-old doesn't want lips? They all want lips. And by the way, we're concentrating on neurotoxin, on Botox, but this is not just about the Botox. This is about, and you're going to see an example of this later on in this program, this is about a lot more than Botox is just the gateway for this. Really, they'll come in for lips. 20-year-olds are coming in for lips. By the way, I don't know if I mentioned this in the video here. Here's the incredible part about this patient. Her name is Taylor, and that is her boyfriend's mother referred her to the AAFE Med Spa. So you get that? She got to us because the guy she's dating's mother referred her son's girlfriend, a 20-year-old, to us because she was already thinking about getting some neurotoxin here. That is really, really incredible for that. That again, when I first started, this is just so far it changed. Now, granted, this is 20 years ago. I mean, 35 was young. 40, they were starting to get it. Nobody was getting preventative Botox for this. Now, I mean, and a patient like this, once she has it, she's going to be getting it for years, just like her hair, just like her nails, and she's going to get into the swing of paying for it. That's an incredible opportunity that every practitioner has right now. I'm amazed, I guess, again, maybe it's just a reflection of when I got started and a reflection of my age. I'm amazed every time I walk in the AAFE Med Spa, the patients look younger and younger because they are younger and younger for this. You want to be known as the most comfortable injector, and for that, you need the most comfortable needle. By the way, this is the only syringe that we use in AAFE training in all of our AAFE Med Spas, and it is called the ComfortTox syringe. You can get it at a place called stattds.com. It's on the screen. Why do we use these? Because look at those two micrographs. This is ComfortTox. This is a multi-bevel super sharp technology that they have got. This slides in. The patient barely feels it. It's a 31 gauge needle tip for that. This is right out of the package versus not a ComfortTox, which could be one of 5 different. We compared about 20 different needle tips under a microscope. As you can see, this is right out of the package, and this is a very, very popular insulin syringe, which I will not mention its name. How do you think that feels when it goes into the skin? Ragged. What is it? What's the patient experience? It hurts. By the way, what's your experience when you use a needle like this? Again, this is not a used needle. This is right out of the package. You can feel it because you've got a good tactile sense. Even with the gloves in there, you can feel it kind of ripping through skin as it's going in there. By far, these are the best needles to use for all of this here. All right, let's go ahead and go to our next patient here. Remember these 3 things: tight skin, tight muscles, adjust dose for prevention, and precision placement. Now we're going to go into a little bit more involved case. That first case, easy case. I could do that all day long. I'll answer the question about dosage right now. I'll give you just general dosages for all of these things. By the way, when it comes to dosaging, whatever I tell you that first patient had for a dosage, the second patient had for a dosage, the third patient had for a dosage is meaningless to you and when it comes to your patient. Every patient, and this is where training comes in. Every patient is carefully evaluated. The muscles are carefully evaluated. What do we evaluate them for? muscle mass, muscle intensity, elevator depressor. How do they interrelate to the other muscles around it? Muscles never stand on their own. When you treat the frontalis muscle, you better know about treating the glabellar region between the eyes that make those. You better know how it's connected to the orbicularis oculi, which is the eye muscles, right? I mean, those, when you tightly close your eyes, that's a round muscle that contracts and tightly controls your eyes. Everything controls the brow shape. Everything controls how it's going to look. For that, general, for that first patient, I'll just give you again generals on this. Maybe she had a total, I would say, of maybe 30 units total. Simple case. I could do that all day. You saw how long it took, and it only took longer on screen because we were talking through it. These things take 5 to 10 minutes. These are really quick cases. And what's the fee going to be for that? Probably somewhere around $350, $400. 10 minutes time, the Botox is going to cost about half of that. Let's say that is pure profit for very little time. And that is why in every dental practice, these are by far the most profitable procedures. There's no lab fee. There's like no fees. All it does is it's literally pure profit delivering this. I mean, that's basically what it is. But how do you deliver it that fast? You get trained really well. It takes us, when people come to AAFE live patient training, they've already been through the didactic. They're coming to treat their patients, spend a few hours just evaluating patients, and then the actual procedure is 5 minutes, right? But it's only 5 minutes when you know everything else. But once you learn it and get to your practice, you could do this all day. I mean, there's nothing that even comes close to an ROI, not just in a dental practice, in a med spa, in a physician's practice, in any kind of practice. There's nothing that literally comes close. Let me show you patient number 2, a little bit more involved here. So let's go ahead and take a look at her, and here we go.
Here is a fantastic case of neurotoxin for the Gen Z patient here. And you're going to be amazed, by the way, at how much neurotoxin a Gen Z patient can really get. So what are we doing here? We are going to mark her up first. We are marking the temporal fusion lines because that's the end of the frontalis. You've got to know your anatomy, and that's what the AAFE is all about. We like to say we are anatomy crazy, and certainly if you want to be a great neurotoxin injector, it's about being knowing the anatomy and being the best injector that you can possibly be, because this is all anatomy based. So we're just going to go ahead and mark that frontalis muscle to where we're going to place it, get a nice good distribution around that frontalis muscle, but we are also putting it very carefully because we want to actually raise the eyebrow just a little bit. And that's going to be doing a few things. It's treating the glabellar area, which we just marked. It's also going to go ahead and treat the superior lateral part of the orbicularis oculi muscle, and that's going to be this right here. The other dots you just saw placed are to treat any crow's feet or to pre-treat the crow's feet, so we don't want to get any on this young patient here. Now we're going to do a little bit of a lip flip just on the upper lip. For the patient, we are going to treat the chin. So you've got to know exactly where to place this, and that's why we are marking it. And that's the easiest way to do this, to make sure that this is really about the precision that you need. Remember, neurotoxin is about precision. You need to know the anatomy and know exactly where you're going to put it. Just marking the masters now, exactly where we want it. And this is after careful assessment and evaluation. You've got to know your assessment and evaluation and know what the patient's symptoms are, if they are, what the goals are. Here it's going to be much more about master slimming. So that is why we are going to actually inject in a few spots, not just in the one spot that we would normally do for most patients here. Here it's about really knowing that anatomy of the masseter muscle so that you can slim it down, not just at the base, but really all around. And now the DAOs, we're going to do that. Now let's go to actually injecting the neurotoxin into those pre-marked areas here. Now we have already set the dosage for this patient. That dosage for this patient is going to be very much tied to her eyes, her deep set or medium set or shallow set eyes. That determines the dosage, especially on a Gen Z patient. You don't need much on a Gen Z patient because they don't have as active of a frontalis. You occasionally will see a patient with a very, very active frontalis for even at Gen Z, but most don't have a very active frontalis. So you're going to keep it relatively low. Same is going to be true for most of the glabellar treatment on the Gen Z. So you're always going to dial back your dosage just a little bit, but you are still going to assess by muscle intensity, muscle mass, all of those different things, and how much of a line she or 11s she may have in that glabellar area right now, the frown lines for that. She doesn't have much, so she doesn't need much. You've really got to go ahead and dial that back. Now, this is going to be to go ahead and give her a little bit more of a raised eyebrow. It's going to be subtle on her, which is what we want. We also didn't treat the frontalis muscle, which is the eyebrow raising muscle, specifically in a few areas so that some of those fibers will still be active while we take out the depressors of the eyebrow. So this is really going to be very crucial on this patient. Everything is very well planned and very well thought out. And again, with Gen Z, even though she is getting quite a number of injections, and she is getting total a healthy dose of neurotoxin, something that you wouldn't think on a Gen Z patient. But on her, though, in some areas, we're going to dial it back a little bit. In other areas, we are going to give her a little bit more or a healthy dosage depending on the muscle. And again, here's the DAO. These are really going to turn up the corners of the mouth just a little bit, which she naturally has some strong DAOs, and depress them a little bit. Now we're going to inject the masseter, but here we're injecting it for masseter slimming, so a little bit different than when you treat it for TMJ. You've got to carefully assess her masseters so you know which parts you want slimmed, and on her it's going to take multiple injections. We want a good distribution of that, and we are also going to go to the deep masseter a little bit too, and you're going to see some of that. Certainly going to see the before and after. You'll really see how she has a really nice shape to her masseter, not just one area that got slimmed. It's really the nice flow from the cheek all the way down to the chin. You will see she will have a really beautiful heart-shaped face, which is what we're going for. Now we're just doing the same thing on the other side. People always ask what kind of dosage are we giving her. We're giving her what's appropriate to our treatment plan, what's appropriate for this patient. Her plan is going to be completely different than any other plan that you're going to make for a patient. So me telling you what the dosage is on her makes no difference to your next patient, because it's not going to fit your next patient at all, like prescription glasses. Now let's go ahead and do a lip flip. On her, we can do a lip flip just on the upper lip because she wants more vertical height just on the upper lip, her choice. That's what she wants, and that's the beautiful thing about a lip flip when you know how to do it. It's precise. Now let's go to before and afters here. And now take a look. Much more of a heart-shaped face. You can really, really see the difference here. She had square masseters. Now it's much more heart-shaped. Beautiful chin now. That's improved there as well. We actually gave her 2 chin injections, one to smooth things out and one to lengthen her chin just a little bit. And that's all about facial balancing, which you can do with both neurotoxin and dermal fillers together. And certainly she's getting fillers as well and getting the whole treatment plan. Nothing stands on its own. Beautiful, beautiful case. She actually didn't like her smile before, where she's really struggling to show a lot of teeth. It's not natural. You can see that she's kind of trying to over smile, and that's because of the bigger masseters that she had before. Now she's got a much more relaxed smile. Looks great, feels great. She absolutely loves the results here. It's time for you to learn this. Time for you to get AAFE certification trained today.
All right, so let's take a look at her, and you can see her just a little bit closer up here. I mean, again, she's not just getting neurotoxin, she's also getting, in her case, cheek filler, a little bit of lip filler. She didn't need much because of the lip flip there. So, I mean, that's the kind of thing that we can do for all these patients here, and it's really, really amazing. And there's her after too. Can certainly see how the shape of her face has really, really changed. So, I want some feedback from you. What do you think about this? Has this been helpful so far? I want to hear from a lot of you because I really want you to be engaged. And I also want to hear from those of you that don't do this yet. Do you think you can do this? What do you think? Do you think you can go ahead and do this? Those of you who do inject, do you do this any differently? What do you think? I mean, is this something is your technique differ from a lot of this here? But I mean, yeah, I hope you're beginning to understand how 20-year-olds or 25-year-olds are a lot different than 35, 40, 50-year-olds. It's going to be a lot more. It's a lot easier. I mean, it's really a lot easier for all of this. All of you can do this. I am, I'm glad. Wait, hang on. I'm sorry. I'm going the wrong way here. Let me just take a look at some of these comments. I tried to open it up so can everybody see each other's comments? I'm hoping that they can, but I don't know why. I opened it up to everybody, so I'm not sure exactly what's going on here. But I'm hoping you can see each other's comments because they're amazing comments here for that. Yes, I'm ready to get out of my comfort zone. Good for you. It is time for you to get out of your comfort zone. It's not going to be hard for you to get out of your comfort zone for this. Yes, I'm ready to inject. Okay, Ashley, it's time to do this. I'm so ready to get out of my comfort zone of just lips. Yes, you should be doing a lot more than lips. There's so much more you can go ahead and do this. I'm not sure what I could do to have you see everyone else's comments. I thought I said it correctly, but or I think they tried to say it. I'm not confident when it comes to marking for placement. That means, Ashley, you're not confident in the anatomy. So you've really got to know the anatomy and study that anatomy. The one thing that's nice about AAFE programs is that you get all of the on-demand program ahead of time so that when you come for live patient training, you can always go back and review the anatomy over and over and over again. You've got to know that anatomy for sure. For that, it's about experience, that's for sure. Newer injector working on getting more experience. You got to get in there. You got to do it. The AAFE we push our attendees to get started for all of this here. I learned to do frontalis at 90 degrees, see the injector doing it at 45 degrees. Really doesn't matter, to be honest with you. It's a matter of getting it in there and making sure you are in the right plane for that. Well, the frontalis is really simple. As soon as you hit bone, you back up, right? The skull is a very good landmark. Do not go through the skull. Okay, we say that all the time. Obviously, it's a joke. You cannot go through the skull, especially with a ComfortDox needle at 31 gauge. That's a nice thing about it here. So, and depth is really important because you want to be in the muscle for all that. But thank you for all the very, very kind, here we go. All right. I think I just opened it up to everybody. Now you should be able to see it from here in. You should be able to see everybody else's chat for all of that. Well, I'm glad you asked about DOA because I'm going to show you the next case that we're seeing. Now you should be all, can you all see it now? Let me see if you can see each other's comments now. Well, it says, no, okay. I can't figure this out. I don't know. It's not working today. Let me see here. Let's go. Here we go. Let's try this again. I'm hoping that'll open it up. It just makes it a little bit more exciting for everybody. So that's it. All right, let's go ahead and move on for this. So you know what? I'm going to come back to some of these questions a little later on. Let me get to this third case, and then I promise you, I will stay for questions, whatever questions you want to ask, we will stay for after we get through this program. Here comes the third case that I want to go ahead and show you. But first, before the third case, let me show you again what you'll see on social media and why Gen Zers are driving, literally driving, but running to get Botox. Here we go ahead and see. Take a look at this. Here we go. Look at her jaw. That's it. That's the entire TikTok. Okay. How long did that take? 10 seconds to see huge jaws go to small jaws. Obviously, she loves it. Obviously, she has hundreds of thousands or a million followers. I forget. I can't keep track of all of these for that. Why wouldn't anybody go ahead and get masseter Botox if you've got big masseters and you are that age? Do Gen Z want to treat the platysma? Kariana, that could not be a better segue to this patient, because you are going to see this patient get 145 units of neurotoxin. In her case, I believe it's going to be Xeomin for that. So take a look at her face ahead of time. Now, again, because some people tell me, well, Gen Z, they don't need a lot of Botox or neurotoxins. Well, you go ahead and take a look at this patient here. First of all, she's got, not huge masseters, but she's got a fairly square jaw. She wants a better shape to her face. Obviously, she's not going to get just neurotoxin. But you'll see that in other programs. We're just going to stick with her neurotoxin in this. But she's also going to get some platysma Botox. So she's going to be pretty much full face. So let's take you through her case here. And again, this is not just the opportunity. This is what this patient really requires. How do I know she requires this? Because it takes real good evaluation and understanding, and that is what this is really all about here. I'm not pre-recorded, Jody, so I don't know what you mean by this is pre-recorded. The case is going to be pre-recorded. So here we go. I turn off my video so you can have a better experience. Here we go.
I want you to meet Madison, definitely in her 20s, definitely a Gen Zer, and she is starting with her first neurotoxin treatment, and we're going to do full face. So we're going to show you parts of her treatment here just for the sake of time. But let's show you some of the marking here on her, and we are going to accomplish a few things here. Why would we mark her up? Because we really need to understand the anatomy. This way we have very precise placement. Neurotoxin, Botox, Xeomin, it's all about precision, precision, precision. So we want to mark this out very carefully to make sure we are exactly in the muscles we want to be in. And this is the masseter muscle, the jaw muscle, and we're going to show you the injections for some of these areas and even more than that. But you want to be exactly in the right place when it comes to the masseter muscle so you don't affect her smile. There can be downsides, and we're also going to go ahead and treat something called the DAO muscles, the depressor anguli oris, and that's what we're marking here. This is a muscle that pulls the corner of the lip down, and we want to relieve that so she has a nice straight smile. And this is the other masseter muscle, for example. Anatomy is everything, and that's why we're anatomy crazy in the AAFE if you want to be a great injector. Now let's go to show you some of her injections, and this is going to be her forehead, the frontalis muscle. You want a broad application on the frontalis muscle. She barely has fine lines at rest here, but she never has to have a wrinkle in her forehead going forward with continuous neurotoxin application every 3 to 4 months. But over time, that it lasts even longer. Many times she'll go for 6 months without having to have a neurotoxin application with repeated applications over time. We find that certainly in Gen Z patients and treating them for a number of years here. But this is also for headaches and migraines and TMJ and bruxism, clenching. Some of this treatment is definitely going to be geared towards that, and that is the beautiful thing with neurotoxin treatment: therapeutic and aesthetic results all at the same time. Now we're going to do those frown lines. This is to prevent those frown lines in front. And notice on her, those of you who inject already, this is the corrugator muscle. Only one injection on this corrugator muscle because she has fairly short corrugator muscles. So one injection is all you need. And that's why all this treatment is so individualized depending on the patient's anatomy. This will be treating her crow's feet. Then when she goes into a big smile, those smile lines around her eyes over time. She's got very fine lines that she's got now. She's never going to have crow's feet with continuous use of neurotoxin. And once they get it, they love it. Believe it that this injection for the lateral orbicularis oculi also will help prevent and help with headaches and migraines as well. Now the masseter jaw muscles. This is also going to slim down her face, as you're going to see in the before and after. She had a fairly square jaw and a fairly diffuse jawline here, and we are going to go ahead and fix that. Now let's go. This is that depressor anguli oris, and that is going to relieve the pressure and turn up the downturn of the corner of her mouth. Now let's go to her temporalis muscles, side of the head. This is really going to help her with headaches, migraine, TMJ, comorbid conditions, all of them together with this. And we are going to do the anterior, the middle, the posterior temporalis on both sides there as well here. These are all quick injections. The dosaging depends on the muscles and careful evaluation beforehand. She's getting a total, believe it or not, when you see all of her treatment, it'll make sense. And again, you're not seeing all of it, but you're seeing part of it. She's getting a total of 145 units of neurotoxin. And this is a Gen Z patient. So imagine that this is going to be a lifetime patient that is going to be coming in and is going to be a very good patient for any aesthetic or therapeutic practice. Now we are going to go and treat her platysma. Why are we treating a platysma muscle on this patient here? Why? Because this also pulls on the corner of her mouth. This also determines what her jawline looks like. She's going to have a much tighter looking jawline just with neurotoxin treatment. No fillers needed for this. This just controlling the muscles by relieving that platysma and also activating some of the other muscles as well. So they'll pull up on the jawline. This one will relieve the jawline just a little bit, and she will have a nice tight jawline. You're going to see the whole shape of her face change because of the masseter muscles and because of these platysma muscle injections as well, including the depressor anguli oris. And even if you don't understand all of the muscles just yet, because you're just getting started or you've never injected neurotoxin yet, you've got to understand that all these muscles work together. And as you learn injecting and you learn the muscles, this is a journey, and you start with foundational training, then you go to a level 2, a level 3, becomes very comprehensive. You can literally change the shape of everyone's face and relieve their oral facial pain just with neurotoxins. So here she is again before. Take a look at her. Fairly square jaw, diffuse jawline, diffuse chin. Now take a look at her afterwards, and you can see this is more of a heart-shaped face. We've brought her jaws, the masseter muscles in, so she's got a beautiful facial appearance now. Take a look at the before and after. Now, she's also had fillers. She's also brought her cheeks out with fillers. She's also had some lips done, as you can see. We don't stop just with neurotoxin. All of these are fairly comprehensive cases once you learn the AAFE curriculum here, and then you go into a smile, and you can see she's got a much more relaxed smile, better facial shape. She is very happy with this. And again, this is a lot of neurotoxin, and you would think, what would a Gen Z patient need? Not much. Oh no, there's a lot we can do for every single Gen Z patient, and this is going to be a lifetime patient for every aesthetic practice, and that's why it makes it such a dream practice. Time for you to learn this. It's time for you to get AAFE certification trained today.
All right. How did you like that case? Go ahead and put that into the comments there. I would love to hear what your thoughts are on that. That is a really interesting case. That's 145 units, 145 units on a Gen Z patient here. I mean, that is really amazing. Now let's take a close look, by the way. I really want you to take a close look with Eric, because again, we can just show you that. I appreciate all the nice comments, and hopefully you can all see it. You can all see it, each other on there. For that, but it really is it is an amazing case. Why is it an amazing case? First time out having neurotoxin for that careful evaluation. I can't say it enough, because that's what it comes down to. It's not just about where to inject it and how much to inject it. It is the whole thing together. And again, this is done by an AAFE graduate on this patient. Look at her eyes. Look at her eyes, the careful placement of neurotoxin has opened up her eyes a little bit, raised her eyebrows just a little bit, not just laterally, but medially. Hard to see here because of the way that she has her hair here. Slimmer face. By the way, she also has oral facial pain, so some of her bruxism and clenching and grinding and headaches and migraines and TMJ are all affected positively by this. That's for sure. Her entire face looks slimmer. It looks more symmetrical here. Her eyes just shine before and after, but her eyes are more open afterwards. Lips, obviously she got some lips too. Look how it comes down to the corner, not the corner of her jaws, but as it comes down and then starts coming up to her chin there. If you saw a side view, you would see kind of like what we call a little bit of a butt chin. You can't see it so much in this for that. The DAO, why would we treat the DAO? Right there, because that's the DAO you saw treated, and we can treat it symmetrically right there. This little downturn that goes away. As a matter of fact, is picked up just a little bit. Those are the kinds of nuances. They're much more than nuances. They're the crux of everything when you are really, really well trained for all that. We could show you later on. Let's show you her smiling picture, of course. You can see her smiling picture. Look at that facial shape when you get to the smiling picture. Again, it's a thinner shape, eyes more open, the less squinting for that. She has to work in the before to really go ahead and do this. Yes, Gen Z can get so much. Yes, her smile looks a lot more relaxed and natural, Corinthia says for that. Gen Z, there's a lot you can do. It's not just about, it's about facial shaping is, I think, my main point. It's not just about getting rid of wrinkles for all that. It's the whole thing put together, and you can all learn to do this too. But it's a stepping stone. By the way, I got to show this case because I absolutely love this case. This is, look at those masseters, those giant jaw muscles beforehand, and with a few injections, though, that really starts to come down. This takes about 6 to 8 weeks to really start to trim down those really giant masseters. This is our patient in the AAFE Med Spa. So like, this is not an AI patient, or this is not Photoshop. This is literally our patient. By the way, it's the only thing she had done were masseter injections. Her lips look bigger because they're not so stretched out. Right? Do you see that? I mean, it's really, really incredible what you can do. But this is only the stepping stone. This is only the stepping stone. Look at this video for that. Because once they start, they're getting a lot more. You'll see what I mean. Here we go.
Starting from the top, I obviously had Botox. Then I had Sculptra in my temples. Then I had PRF in my under eyes. And then I also ended up getting filler in my under eyes. Then I got filler in my cheeks. Then I got filler, I got a nose job. Then I got filler right here to like minimize the smile lines. Then I got my lips done, filled, and then sometimes I do a lip flip, but I haven't been doing the lip flip because I just got my teeth done, where I got Invisalign and bonding. So I like my teeth, so I don't want them to cover it too much. Then I got masseter Botox to slim my jaw, and then I got chin filler to kind of give that elongated effect. Botox in my tech neck lines. She didn't tell me that. And I think that's it. Oh, you also have extensions. Okay, yeah, I have extensions in my hair colored. Don't judge me. Just want to say I am taking care of the sun damage.
There is no end. There is no end. Look at, I mean, I don't know how old these are specifically. They're not very old for that. By the way, if you're a dentist on here, you can also do the teeth and the Invisalign and the whitening and everything else, along with absolutely everything else. This is a big, deep field that patients want. She's paying it all out of pocket. Again, none of this insurance nonsense, none of that. So what do you think about this? Is this a stepping stone? How long are these patients going to be in your practice? Go ahead and put that in there. And again, ask questions. I'm going to take questions for all of this, but we've got a couple of questions. First of all, what's the financial impact into a practice here? It is really, really substantial here. Whether you're opening a new practice or whether you're a part of a practice, but maybe you have a dental practice or a medical practice that you're already involved in, it is really substantial. I'm not going to go through all the numbers here. All we do, well, I just want to just globally, I'll tell you what we do. AAFE member production survey. This is, we go ahead and survey. We have thousands of AAFE members across all healthcare professionals. And about a year out after they've taken a level 1 Botox and level 1 filler course, we go ahead and survey them. What have you done with it, pretty much? Bottom line, just go to the bottom line. AAFE members across the board who've introduced Botox and dermal fillers into their offices or started offices have seen an average increase of $52,500 of production a month. That's not so hard to believe because you have got, what's a typical Botox treatment? I would say anywhere between $500 to $1,000, right, on one patient. Typical lip filler is going to be $600 to $750. Lips and cheeks are $1,500, $2,000. It's not hard to get $52,000 of production a month. And by the way, for the dental office, this is in addition to what you were doing already. Dental or medical office, this is already in addition to what you're doing already. So let's talk about training. We've got a lot of training questions along all platforms here. And let's talk about the AAFE special offer. That's only going to be here. It's only going to be now if you want it. Usually I talk about it before. I'm just wanted to put everything off till now for this. Even if you're an advanced injector already, we're going to show you how you can use it because this is the best offer they have ever had. You cannot find this on their website, as you're going to see. The AAFE really wanted to do something different for this webinar and everybody on this webinar that will deliver elite level training, resources, and results, including the AAFE courses are ready to inject. You'll be injecting paying patients in as little as 14 days. We're not going to let go of you until we are pushing you to get started, because as soon as you get trained, you need to get started. You're going to learn from that great faculty I talked about before. You can bring a patient to a course. We love it when you bring a patient to a course. One of the biggest questions that we usually get, why? Because you're going to take that patient home and you're going to see what happens when you inject Botox. You're going to see what happens when you inject fillers. That's the best way to learn. If you can't bring a patient to a course, you can find one at the course. There's no question about that. Everybody that comes, they all want to be injected. Really better educational experience. We want you to have the best educational experience. Here's where we're really different than everybody else. We want your tuition. We never want to hear from you again. We are going to push you to get started, and that's what a lot of you need. But bring a patient. That's the best way to learn. One-on-one instruction and credit courses, and only the AAFE has got post-course support. No one else have it. We have forum boards. We have full-time faculty that answers questions for that. The forum boards and the community is the most nurturing community that is absolutely out there for this. But we also wanted to offer, the AAFE wants to offer a reasonable investment with life-changing return on investment, because literally this is life-changing for all of you. You want that dream practice. You want to get paid what you are really worth, whether you're going to do it part-time, whether you're going to do it full-time, whether you're going to own a med spa, which is what a lot of you wanted, whether you wanted that financial freedom. So when you consider that injectors, and we know this from thousands of AAFE attendees that take this every single year with the AAFE, they're adding $10,000 to $50,000 to $100,000 a month. Don't sneeze at $10,000 a month. You can do a lot with $10,000 a month production for that. Any program that the AAFE has is easily worth $10,000 plus, because this is about your financial freedom. It's about your control of your time from here on in your healthcare career. And it's about dreaming. It's about building that dream practice and really loving what you do. It's great practicing on healthy, happy patients. I will tell you this for this. So we've really structured a plan that you're not going to pay $10,000. That's going to be accessible. So if you're a new injector or an advanced injector, and we'll tell you what the opportunities are for brand new and advanced injectors, you can take advantage of this opportunity right now. It's only $3,097, aafespecial.com, plus bonuses. And everyone talks about this kind of math and girl math and this math and that math. Here's the AAFE math. $3,97 and over $11,000 worth of value and packages that package you're going to get. This is one package. You can only get it at aafespecial.com. You can scour the AAFE website You will not find another package like this. This is a pre-Black Friday. They're not even calling it that. This is better than any Black Friday. Anybody that's been on, we appreciate all the AAFE members that are saying really nice things about the AAFE. We appreciate all that. They paid more than what this. But if you've already been trained by the AAFE, you can use this for advanced courses, and we'll answer some of your questions. So here is the total package and all the bonuses that you're going to get. Only AAFESpecial.com. I forgot to mention so far, there are only 20 of these packages available. We'll show you the locations. It's pretty much all over the United States. But there are only 20 of these packages available. The AAFE just popped up, and thank you, and is reminding me of some of these things. I see Renee from the AAFE is on as well, and she can answer some questions about courses. Bonus number one, AAFE Med Spa Aesthetic Practice Business On-Demand Training. You need the clinical. That's what we're going to train you in the clinical courses. You need the business. And that's why it's part of this. You're not paying $9.97. It's worth $9.97. That's what they sell it for on the website. But you are going to get it as part of this package. Number one, it's probably the top bonus here. Up to $750 of injectables to be used at the course. So when you come to the course, that's what you're going to get. One team member per course. And that is so, and that's got a value of $750 over 2 courses. Access to exclusive member forums and post-course support worth $997. Bonus number 5, 12 months of AAFE membership, and there's a lot of the use of the logo, use of all the different things. You are going to get bonus number 6, full office. You're going to get the office locator. Bonus number 7, full office forms. That's what I really wanted to get to, because we're not going to leave you high and dry. We're going to train you. We're going to give you all the forms that you need. We're going to give you the business training here. That's what we are going to go ahead and give you. And then discounts on additional courses. There's actually an extra special bonus coming up that even I don't think Renee or the AAFE knows about, that they added at the last minute for all that. QR code will take you to AAFESpecial.com. Only 20 of these. You're going to get 2 live patient certification courses and all of these bonuses. So we'll go through which two live patient training courses might be best for you. If you're just getting started, then that is going to be level 1 Botox and level 2 and level 1 fillers, or TMJ. We'll talk about that in just a little bit, but you're going to get 2 live patient certification courses for $3,097, and you're going to save a ton of money on that, plus all these bonuses. Entire package worth over $11,000. We call that AAFE math. Now, it's not an expense. It's a complete investment in you. Now, I will tell you this. I've been told so many times over my professional career, oh, you're going to make your money back in 6 months, in 2 months. You buy $100,000 piece of equipment. You take, if you're a dentist, you take an implant course. You take any other kind of course. Oh, you're going to make your money back. Literally, you can make your money back. $3,097. Average Botox treatment is $500 to $600. Average lifts is $750. If you treat 2 Botox patients per day, you're going to make your money back in the first 2 weeks. If you go ahead and do fillers and that, you make it back literally in about 5 to 6 patients. Then you have the skills for the rest of your career. You should definitely reinvest in yourself and do level 2, level 3. We'll go talk about all of those kinds of things just coming up for that. But I have a question for you. You all went to medical school, dental school, nursing school. How long did it take you to pay that off? Or are you still paying that off? Now, has that paid off for you? Most certainly it's paid off for you. Has that paid off for you after 5 or 6 patients? After 5 or 6 years? Not if you're still paying it. I'm not knocking it, because it took me 20 years to pay off school. But I'm saying you're talking about a real minimum investment to get started in all of this. And that's really something. Plus, you're fully protected. We are going to make sure you are confident and prepared. We're not like any other educational organization in injectables that just take a fee up front, come to classes, goodbye. We really don't want to hear from you again for that. That's how much we believe in this program. It is very, very unique, certainly worth every penny, and you will not get this. Tell me in the chat if you're ready to break free from the grind, if you're ready to expand your career. Go ahead and say yes in the chat, no matter what platform you're on. A lot of yeses coming in on the different social media platforms for all of this. Do you want to take control of your future? Do you want to take control of your time? And do you want to try a different part of medicine or dentistry? Don't have to give up what you're doing. Certainly, many of you want to give up what you're doing or you're burnt out. That's true across every healthcare professional. I mean, we just trained a whole bunch. I was at a course here in Cleveland this past weekend. Every single one of them is like, I'm just burnt out. I'm just burnt out. I'm an ER nurse. I've been an ER nurse for 3 years. I am burnt out, right? It may or may not be. I'm not knocking ER. It can be any form of medicine. A dentist, I'm bored. I'm just, I'm just burnt out, right? Nurse practitioner, want to, find my own path, take control of my future. All of that is possible. So if you want it, then grab this package, and you need to grab this package right now. You got a whole bunch of live patient training courses, all CME certification courses that you can take advantage of. Again, go to AAFE Special right now. Only 20 packages, and there are a bunch that are being taken. I'll try to announce some of the people later on. Here's the locations. It's all over the U.S. Certainly, we have a few international locations, but let's just stick to the U.S. for right now. Rhonda, you're not kidding. Try 39 years of nursing. I am so burnt out. No, you deserve an MVP award. 39 years of nursing is a long time for nursing. But listen, everyone needs nurses. You've done a tremendous service, but it is time to go ahead, especially at this point in your career. You want something that can give you a lot more freedom and certainly be a lot more fun. But I want to say, it's not just about fun. It's just not just about freedom. It's about also, it's a tremendous service for patients. You're making them look great and feel great. Believe me, there's a lot of self-esteem that really is going on for this. This is only till midnight tonight. I don't know if I made enough of a point of this. After midnight tonight, this is it. Yes, show Rhonda. All of you, or a lot of you are on here, be active. Show Rhonda some love in the chat. Honestly, she's been a real champ for that, because we all know how tough nursing is. So some of you give Rhonda a little bit more love, because she deserves it. You all deserve it, because really, I don't care if it's been a year. It doesn't really matter. I don't care if it's been a year for all of that. You've all been taking care of patients for that. So yes, only till midnight tonight. Here is an additional bonus if you want it, because I'm going to go through the courses a little bit more in detail to show you what you should be thinking of. In terms of you're just getting started, or you're going to ahead and do that, or you're advanced already, where should you go from here? Add a third course for only $900 that you're going to have to just grab this package of 2 courses. Then the AAFE team will contact you tomorrow. Don't worry about your location. You'll get your location. You can use this now. You can use this next year. You can use it whenever you want, but use it now. Get started, because the sooner you get started, the sooner we are going to push you to go ahead and start working on paying patients here. By the way, all the marketing questions, that AAFE Med Spa Aesthetic Practice Business On Demand training, that's part of this. It's the #1 bonus here. That's exactly what it goes to. How to market. I'm going to go through what's in that course actually in a couple of minutes for this. But grab one of these packages now, and then they're going to ask you tomorrow. They're going to give you one chance. Do you want to add on a third course for only $900? Normally, every individual course is about $19.97, so you're going to save big time on that, because many times these courses are packaged together in the same, in the same week or whatever it is. It makes it very easy to go ahead and do this. So here are the bonuses again. I want to show you what's in the Med Spa Aesthetic Practice course here, but I'm telling you, grab it. This is one of a kind. They're going to come out with their Black Friday specials. It will not be as good as this. You are getting the best special that they have right now, and there won't be anything better coming. And this is gone by midnight tonight, or the first 20 packages. I think that other side was a mistake when it said 12. They had kicked it up to 20 before because they knew this would be popular. I think it's good because I think 12 are already gone, as what the AAFE is telling me. Bonus number 1, Med Spa Aesthetic Practice Business on Demand Training. Bonus number 2, $750 of injectables to be used at the 2 courses. Bonus number 3, 1 team member per course. That's worth $750. You can add all this up yourself. Member forums, post-course support worth $997. 12 months of AAFE membership worth $597. Use of the logo, use of, I mean, so many things that come with AAFE membership. AAFE member office locator worth $997. The AAFE gets thousands of consumers that come looking for a provider every single week. You're going to get all the office forms you need for injectable therapy, informed consents, diagnostic forms, treatment forms, everything that you need, pre-op instruction, post-op instructions, all of that, and discounts on additional courses, including that special bonus tonight. Now, what courses should you pick? Because this is really important. Again, the AAFE will work with you when they contact you tomorrow on what? If you're just getting started, foundational aesthetic, and you want the aesthetic route, level 1 Botox and level 1 fillers. That is where to go ahead and start. If you want oral facial pain, trigger point therapy, then, and you're getting this 2-course package, then level 1 Botox, level 1 TMJ oral facial pain trigger point therapy with Botox. That's where you want to start. Now, those of you who want aesthetic and facial pain and the foundational just getting started, add on that 3rd course after you buy this 2-course package. Add on that 3rd course for an extra $900. You're saving another $1,000 on that, and you can take level 1 Botox, level 1 fillers, and level 1 oral facial pain trigger point therapy all in one set. So that is very, very efficient. If you're advanced, you've taken a level 1, you're doing some, take a level 2 Botox, a level 2 fillers. That's where you're going to get your DAOs and your chin Botox, and that's where you're going to start getting mid-face fillers, lower face, mid-face fillers, just more. Again, more services over the level 1. The level 1 Botox and level 1 fillers really gives you about 80% of any practice. And that's why we say you can get started in as little as 14 days, 30 days for sure, by treating the bread and butter, the literally everyday procedures of Botox and fillers just with level 1 Botox. But after you do a few cases, you should definitely get to a level 2 Botox where you're going to get more areas, more services that you can provide, and more comprehensive facial planning. And then if you're ready to do cheeks and you're ready to do those things and you want more advanced training, the master level 3 courses of Botox and level 3 Botox, level 3 fillers, outstanding. That is going to give you very comprehensive full face neurotoxin, full face fillers there, and really get you, how do you put this entire face together? But it's a curriculum. I mean, you can't just jump to level 3. It doesn't work like that. You didn't, come in medical, dental, or nursing school. You didn't just jump to the highest thing and worry about the foundation later. This is a real curriculum. Those of you who are somewhat advanced, who have been thinking about lifting PDO threads, well, then you should get into the Master Lifter courses, which is a level 1 and a level 2 lifting PDO threads. That makes a good 2-course package there as well. Those of you who want anatomy, inject and dissect, cadaver lab, and ultrasound training, that's 2 courses, and that will be a good 2-course package for you as well. So that'll really help you, because a lot of you have taken advantage of these packages already. So congratulations to Dr. Peter, congratulations to V, congratulations to Jessica, congratulations to Amanda, congratulations to Sydney, congratulations to Jack. But I may not get to all these names here, so I apologize if I don't get to all of your names for that. Let me show you what's in the Med Spa Aesthetic Practice business on-demand training, which you're getting as part of this package if you grab one of those 2-course packages. How to have a successful aesthetic practice. What services should I offer? Obviously, it's going to be injectables. What else? Understanding med spa overhead and making the right equipment choices. Do you know the number one thing that wipes out med spas every single time? Equipment. You start going for the lasers, for the big equipment, the small equipment, you start getting into leases. I'm not saying you shouldn't, but there's a progression. And if you do it too early, you will be out of business. It's the number one reason that med spas go broke, is investing in heavy equipment too fast. You got to know how to think about these things. Med spa agreements, employee agreements, medical director agreements, who needs them, and how to go ahead and network and get them. Finding and keeping a great med spa team. Employees are everything. They are absolutely everything. Branding your med spa, strategically setting up your med spa, internal marketing strategy, self-discovery for that. All of this we cover. This is why this makes it such a valuable course on its own. It's worth $9.97 on its own. I think that's already a discounted price. So if you want just that, go and go ahead and look that up on the AAFE website. How to do a great consultation, and how do you plant seeds in the patient's mind, because you want to go ahead and have this patient for a long time. I don't have to do all the treatment now. We have this patient for a long time. Delivering the services, fee strategies, specific profitability of injectables, pricing strategies, social media to build your practice, how to have a great private event, a Botox party. Hate the term, but you know what I mean. And what should you have a Botox party somewhere else? Should you have it in your office? We cover all that and a lot more. And that's why this package is so valuable for that. Lifting PO threads. A lot of you are commenting, what about lifting PO threads? You'd like to see a case. I have a case. Tell me in the chat if you want to see a case of lifting PO threads. I'm happy to go ahead and show it to you. But if there's a demand, then we'll stick around and show you a lifting PO threads case for that. Those of you who are a little bit more advanced, lifting PO threads are absolutely fantastic for that. Wow, there's a lot of you that want to see it. Not just in the chat, on the other platforms. Okay, we're going to go ahead and show it for that. But last call to grab these packages. These are great. Let me answer some questions here, because I said I would take questions. The AAFE, if you want that 3rd course, sign up for the 2-course package, grab that, secure that. Again, use it now, use it later, doesn't really matter. And tell me who's in on this 2-course package for you. I got some of your names. I may not have gotten all of your names for all of this. This is the best value you're going to get. This is over $11,000 worth for $3,097, 5-6 patients, and you have made your money back on this, and you have these skills and the AAFE support for the rest of your career here. And that is really great. And again, hopefully you're going to come back as part of more of that, for more training, because that's really what it's all about. Don't stay stagnant. This field is really deep, and that's what we love so much about it. It's really a deep field for this. Okay, let me take some questions here. Let me see here. Let's take a look here. Okay, we answered that. Sculpture, we have a separate sculpture course, so you can go ahead and check that out. Is this I'm not sure, Yerika or Eureka? I'm not sure exactly how to say your name here. So I don't know what you wrote. What does this mean? Is this a presential class? I don't know what that means. I'm sorry. I'm in South California. We're in South California all the time. So definitely where you come to an AAFE course, you'll find one in South California all the time. Let me just take a look. Let's see. Questions. How do you market Botox and fillers for your practice? Again, this med spa aesthetic practice business, I mean, internal marketing, external marketing, there's a lot of ways to go ahead and market this. Okay, PO threads coming up next. Is there a concern for muscle atrophy for long-time Botox in a younger patient? No, because you're not going to overload a younger patient with neurotoxin or with Botox at any one time, number one. And number two, like that patient I showed before with those giant masseters, right? She had these giant masseters in there. That's not atrophy. What she has with these big masseters is not normal. So we're just trying to get them down to normal size. And that's going to be really allow her to go ahead and function normally for that. And using neurotoxin over time, maintain that really, really great, great facial shape. But more than that, normal masseters. So she's not beating the heck out of her, out of her mouth. I mean, out of her teeth and everything else for all of that. I'm not saying any hands-on in Richmond, though, is listed as city with classes. Richmond, we're definitely in Richmond, Virginia. So, I mean, that comes up at least quarterly. I think you mean Richmond, Virginia. It's at least quarterly, if not more than that. So you can check with the AAFE. We're in Richmond all the time for that. Congratulations to Danielle, another one that popped up, and Anthony and Jessica and Matthew. Congratulations to all of that. And Juanita, congratulations to you there as well here. Why were there 3 points injected in the masseter? Just depends on the masseter. For that patient, was appropriate. For many patients, we only have one injection point. It just really depends on the muscle mass, muscle intensity, and where that masseter is, and just really the strength of it for that. In that case, what you saw, we were not treating the deep part of it too, but we do deep injections too. ComfortX makes a great bigger syringe that will go into the deep part of the masseter for that. All right, let's go ahead and that. Richmond, Virginia, 2/5/2026. So if you want it, go ahead and grab it here. All right, I'm going to go straight to the PDO threads for there, but there's my contact information again. Let me go ahead once again, and I'll show this again. Let's go to PDO threads just real quickly. Again, this is just going to be just a very, very topical case here for PDO threads. So give you an idea. Lifting PDO threads is what we're going to talk about. This patient got lifting PDO threads, one appointment, and she got this kind of lift. That is it. Could she go for a facelift? Absolutely, she could go for a facelift, but she didn't want a facelift. She wanted to go the minimally invasive route, and that's what we can do. I'm not going to show you her case because this is a Gen Z. I'm going to show you a Gen Z case of getting lifting PDO threads because, again, Gen Z is getting just about everybody, just about literally everything here for that. But certainly, generally, we are doing older patients on this. This is what lifting PDO threads look like. They are a polydioxanone thread. Polydioxanone is a suture material. It's been around for a really, really long time. Slowly absorbable suture material. And these have got these barbs on them. Top one is a barbed thread. The bottom three are called molded threads. Don't worry about that right now. V-Soft Lift, the best PDO threads on the market. And what do I mean by that? They are the strongest. What does the strongest mean? The strongest means that the strongest means is here's what you want. You want the maximum lift with the least amount of threads, not what you see on social media where they put in 20, 30 threads on one side of the face to get a lift. That is the maximum amount of threads for the least amount of lift. That means every thread is not very strong. You want the strongest thread out there. That by far is going to be V-Soft Lift every single time. It's not me saying that. I'll show you. They say that pretty much because for every one V-Soft Lift PDO thread that we need, you need 3 to 4 Nova threads, 4 to 5 Mint PDO threads. Again, it's not me showing the cases. It's them showing the cases. And here is a case like this. This is Mint PDO or Nova threads. They look pretty much the same for that. Their trainers have gone back and forth. That's not a negative. It just depends who they're working with at any given time, but the technique is the same. If you're putting in 20 threads on each side of the face, you're using a very weak thread. And we're going to use 3 or 4 threads, and that will do it for each side of the face. And there are a lot of considerations for that. This is almost a surgical procedure. And by the way, Mint PDO, for example, will tell you, I've gone through the training, so have some of you, that they will sedate the patient beforehand. Afterwards, the patient will be on antibiotics and narcotics for post-op control here. That's not how we want to do lifting pedio threads. It should be a non-surgical, mini-invasive lift, and that's what we do with VSoft lift threads and AAFE techniques. And here on the left, you can see a case for VSoft lift pedio threads. That's the way to do it versus 20. Both are good cases. You'll get a good result. But why would you use 20 if you could use 4? So let me just show you a quick case just to give you a taste of what this looks like. So here we go.
Let's show you this patient. She is a mid-20s, barely mid-20s treatment with lifting pedio threads for a cheek lift. First thing we're going to do is get her numb, where we're going to place the pilot hole. This is a pilot hole needle that's going to be a little bigger than the pedio thread that we are using. This is an 18 gauge, and you can see the vectors. We're using what is called a reverse vector for this one. But the first thing we are going to do is we are going to pre-tunnel these 2 VSoft Lift RT molded threads to go ahead and make sure that we are going to be comfortable, number one, and number two, make sure we are in the right plane. That's what we are trying to accomplish with this pre-tunneling. That is a ComfortTox microcannula, and that is some lidocaine, and we are going up that vector, and we are going to go ahead and be in the right plane, and that's going to pre-tunnel this, making the placement of these pedio threads so much easier here. And here we are going with the molded RD thread, and we are going to go ahead and place it right in there. Follow along the same plane. You almost drop right into it, and we are going to go what's called a reverse vector, and this is going to give us a little better lift because we're only going to concentrate on her cheek. As you can see, I don't have to go all the way down to the hub of that needle. That will be plenty of pulling power, and this is the strongest molded thread that is on the market in our opinion, and we've used them all, and there's no question. That's why we're only using 2 threads on her. If you're using any other kind of a pedio thread, molded thread, you would need 4 to 5 or 6, because I mean, literally, you can see what everyone else does when they place threads. They would be placing easily 4 to 6 threads on this 2 to 3 times. With VSoft, these are the strongest ones. You want to use the strongest thread for the maximum lift, and that means you're going to use the least amount of threads here, and that's exactly what we're trying to accomplish. And it's important. You don't have to go the entire length to the hub here. All I need is that little area because we are doing a cheek lift, and that is what we're going to go ahead and do. Give it a really good pull to really pull that cheek up. She doesn't have jowls. She's a young patient, and that has repositioned that just beautifully. We're going to end up and smooth that out. He'll feel a little clicking as those the molded threads go ahead and engage there, and that really keeps it up beautifully, as you can go ahead and see. She's also set up for an eyebrow lift, which we'll show you in a future advanced video here, and that is looking just beautiful. We're going to cover that with a Band-Aid when we are ready to go. Let's go ahead and show you the other side. You can do the same thing. Little bit of, with a ComfortTox syringe, a little bit of lidocaine 2%, pilot hole needle, make sure she's good and numb, 18 gauge because we're using a 19 gauge VSoft Lift RD molded thread, and we are going to really open that up, and we're going to, this also gets you into the right plane, by the way, but that shaking back and forth really gets this opened up so that your micro cannula, and this is going to be, you could use a 19 gauge or even a smaller micro cannula because you're only pre-tunneling, going into the right plane, which is going to be the subdermal plane, getting to the SMAS. And that's what we're going to do. Go up, give it a little thread of some lidocaine, and that's going to get her nice and numb and make this very comfortable. So you can see she is very comfortable. Now we're going to do, again, a reverse vector, go up to where we think we need to go. This one is going to be a little deeper than the other side because that's what it requires. Going to give that a good reverse pull, and also here comes the next one. And these are fairly quick procedures when you are well trained by the AAFE, and it's the AAFE techniques and the right thread using the strongest thread on the market. That's what's going to give you such a great result. Place the second one. It literally does go this fast. Give them a nice pull, both of those up. And by the way, we're going to give her some neurotoxin at the same appointment after we're done with this treatment here. And again, we're going to treat her eyebrows, and we'll show you that in the future sometime. But now here we are going to go ahead and use one more because we want a little bigger lift on this side, and you'll be able to go ahead and see the results on her when it comes to this one. This is, and again, this is a little bit deeper, and this was needs it almost needs more of a fill if you want, and more of a lift. And that's why we chose to use 3 on this side here, because this will go ahead and really lift this up a little bit more. Now we're going to go ahead and trim all those back, and we are going to pretty much be done. And then put some Band-Aids on there, give her some good post-op instructions not to really move anything. We're not going to want her to touch her face anyway, because she's going to get neurotoxin after that there as well here. And that's always a game time decision. If you feel you need an extra thread, it's okay. This again would take 6 to 8 threads if it was any other thread on the market. Don't believe me? Go ahead and take a look at what they do and what they teach, and certainly we can show you some comparisons. Give her some nice smoothing back and forth, and you can see she tolerated the procedure very well here. And now let's show you some before and afters here. And here is some before and afters. And I like to show the smiling one because when you look at the smiling before and after, you can really appreciate, look how her cheeks are lifted. When she goes into a full smile on the before, on the left side, you can see her cheeks are naturally heavy. And again, she's only mid-20s. Her cheeks are naturally heavy, and it's hard for her to really go into a full smile. You give her that cheek lift with just a few of the VSoft PDO threads, and again, you are seeing just a gorgeous cheek lift as a result. And again, a little bit more on the one side because that's what she needed. And why does she want all this in her mid-20s? Because she is a beauty pageant contestant. And here you can really see those gorgeous cheeks that have been repositioned up with the lifting PDO threads. And of course, she's had some filler. Of course, she is going to get some neurotoxin there as well for the complete look. Everything is going to be nice and smooth. Everything is going to be nice and lifted. And she's only in her mid-20s. They are getting these procedures more and more. To them, it is self-care, just like hair and nails. First demographic to ever go ahead and get all these procedures, not be embarrassed by it at all. It's time for you to learn this, as now these patients are making up to 35% of all injectable patients. Time for you to learn this, and it's time for you to get AAFE certification trained today.
All righty, let's take some final questions here, and let's go. So you can see her. That's her before and after. Let me turn my camera back on. So appreciate all of you that are staying on. Boy, you stayed on for a long time. Yes, it is. Here we go. All right, let's take a look. This is yes, that's all Peyton there. I mean, this kind of case. Let's just give you an idea in terms of how this applies to your practice, right? This case used 6 V-Soft Lift PDO threads, 3 on each side. That's it. Now, when I say they're the strongest threads, I mean they're the strongest threads. Your cost $210, patient fee $1,250 to $1,800. You can certainly go to $2,250 on these because they're paying for results, not for number of threads. It's not a commodity here. Treatment time is about 20 minutes. Number of treatments is 1. Results lasting 12 to 24 months. I mean, that is, it's an amazing tool to go ahead and use. Again, if you're a little bit more advanced, if you've ever thought about lifting PDO threads, we put these things all in all the time on young patients and older patients. Young patients, again, are much easier. Many times they just have diffuse jawlines. They just need a little snatch back, or they don't have much in terms of cheeks, and they just need a lift to give them some cheeks there as well. So there's so much you can do, and yes, you can use that 2-course package. Definitely go ahead and use it if you want to take level 1 and level 2 of PDO threads. Again, just a suggestion. You can mix and match any 2 courses that you absolutely want for all these things. But there is another way to get trained on lifting PDO threads. One is through the AAFE directly. The other way is you'll get AAFE training, but if you go to vsoftlift.us, if you've been thinking about getting trained in PDO threads, and by golly, use the strongest PDO thread that's out there. That's always going to be VSoft Lift. They have these PDO thread packages. And if you buy a package, you will get AAFE group training, a normal AAFE course. If you buy a big enough package, they will send an AAFE trainer to your office and have a private in-office training, and that will really give you a head start to providing lifting PDO threads. But that's going to be through vSoft Lift, same AAFE training, same on demand, same live patient training, but it happens in your office. So that's a great opportunity there as well. All right, last call for this, and I'll answer some questions too. Let me just see who else as part of this. Congratulations to Carrie, who grabbed a package here. So again, the AAFE will be in touch with you tomorrow for to get you into the courses that you want and to get started immediately on the training, but also get you all of these bonuses here. So AAFE Med Spa Aesthetic Practice Business, 2 live patient certification courses, and all of this. So you're going to get bonus 1 through 8 and all of the benefits there, a total package value over $11,000. Again, here is what we teach in that Med Spa training course. You can see the topics. It's A to Z. It's how to have a really aesthetic practice, a really successful aesthetic practice from the business part. The live patient training courses are going to be on the clinical part. All of this is till midnight tonight. The final few packages are available right now. So if you want them, snag them. You can use them now. You can use them a year from now. You can use them next year, which is not that far away, right? So you can really use these whenever you want. But it is a full business training course. Because again, it's about the clinical and it's certainly about the business training there as well. And because you hung on so long, if you snag one of these 2-course packages, the AAFE will ask you tomorrow when they get you into the courses, if you want to add on one more third course for only $900, that's another savings of $1,000. So if you want it, go ahead and grab it here. So thank you for being on. God, hundreds of you are still on. Really appreciate that. And thank you for being part of this. It's been a lot of fun sharing this all with you. So hang on, let me just go to that. Let me just see if there are final questions. What happened to the chat here? Let me see the chat here. Okay. Let's take a look. I purchased Level 2 package through vSoft. It's a great idea. Yes, that is a great idea. And let's see. And that's Rhonda. Great, Rhonda. Great to have you on here. And again, thank you again for all 39 years of your service there for that. All right. Sherry says, can you please explain why you are inserting threads from bottom to top, not from up to down? That really just depends on the different vectors. That all comes with training for that. There are times you'll go from the top down. There are times you'll go from the bottom up. It's just about vectors and the face, and that's more than I can handle in just a minute here for that. Just very, very case dependent for that. Also depends. For neck, I'm very often going ahead and pulling it the other way and starting at the bottom of the neck and going up and just twisting it up. It just really depends. Is a supervising physician required to be on site for FNP injection and med spa in Tennessee? No. FNP, you can have pretty much an independent practice with a supervising physician or a collaborating physician, but they do not have to be on site. I'm just telling you what I know because we actually have a training center in Nashville and that MP does not have a physician on site. So we know from personal experience that that is the case. So with that, Jessica, you can absolutely go ahead and have that kind of practice of your dreams, but sign up for grab one of these last packages right now before midnight tonight or before these first 20 packages go. And it's not too far off before they are gone. So any other questions, we really appreciate it. You can always email me afterwards. AAFESpecial.com for grab the last packages for tonight's. You're not going to see a better deal from the AAFE. You're not going to see a better Black Friday deal. You're not going to see any better deal. If you want it and you're ready and you've been thinking about doing it, now is the time to really go ahead and get going here. AAFEvirtual.com, StatDDS.com. That's where you'll find all the ComfortTux needles and all their other products. Vsoft Lift, that's where you can go ahead and get these great threads and also the training deals as well. If you want a great PRF online certification course, perfect PRF. WaveAesthetics.com is for those of you who want an aesthetic ultrasound, and AAFEwebinars.com for that here. Can I get trained if I'm only an esthetician with interest of getting nurse training, depending on the state that you're in? An esthetician with a medical director, you can go ahead and get training. So you can email the AAFE and they'll have more information about that at info@facialesthetics.org. So thank you to all of you. I hope I didn't miss anybody that grabbed a package here. Thank you so much to all of you for being on. That price is for only level 1. You can use the 2-course package for any 2 courses that you want. It can be a level 1, it can be a level 2. Level 1 Botox is 1 course, level 1 filler is another course. So that's a good level 1 Yerika if you want to go ahead and take a look at that. Or you can use it for a level 2. You can really use it for anything that you want. And you don't even have to worry about that right now. Lock in the package, because that's what you should be worried about before the packages are gone. Then the AAFE will work with you tomorrow to get you whatever courses you want and whatever locations you want there as well here. So thank you to all of you for being on, hanging out with us. We do webinars almost every week. Check AAFEwebinars.com for what's coming up next. We hope to see you again real soon. Take care, everybody. Continued success.